This is a video for anybody who's considering that they're going to have their gender affirmation surgery in 2024. I'm just going to go through a bunch of different tips I have when it comes to planning and getting ready so you're going to have the best possible result and experience. So first of all, payment. And figuring out how you're going to be able to afford surgery can be really tricky for a lot of people. And if at all possible, it's best to use your insurance benefits if you have them. Now, how do you figure this out? So the first thing you want to do, if you have no clue, is get your insurance card. And on the back of it, there will be a number for customer services. And I want you to remember that you are empowered in this situation because you are the customer here. So you're going to call customer service, and the first question is, do I have benefits for gender dysphoria? And that will let you know if you have coverage at all. And thankfully these days, the majority of insurance plans do have it. Now, if the answer is no, you may need to think about getting new insurance. Maybe next time round. Open enrollment for most people is towards the end of the year. So that's one way you can do it. Or think about financing the surgery. Crowdsourcing as well, allow crowdfunding. A lot of people use that as well, such as GoFundMe. So, but it's good to figure out first of all if you have benefits. If your surgeon, like myself, is out of network, you also need to ask, what are your out of network benefits? Do you have an extra deductible? What is your deductible? Deductible very simply means how much you're going to have to pay before your insurance kicks in. And these days we see a lot of folks have high deductibles. So I've seen $10,000. A patient has to pay $10,000, which could be all of the surgery before insurance even kicks in. So that's worthwhile knowing. The next question for your insurance company is, as a patient, what do you have to prove in order to get your gender affirmation care? Usually this will vary whether it's top surgery or bottom surgery. And on average for top surgery, usually the insurance company is going to want to see one letter from one mental health professional. For bottom surgery, usually a letter from a mental health professional and your endocrine doctor. So these are all things you can be working on. I oftentimes say that one of the biggest barriers to gender affirmation care in this country is paperwork and all the loops and hoops patients have to jump through in order to get their surgery, but it is manageable, especially if you advocate for yourself and stay on top of the paperwork. And oftentimes your surgeon's office can help with this. Sometimes your mental health professional can help guide you through this as well. And so typically, if we're planning to use insurance, plan ahead that you're going to need at least one letter from one mental health professional. Okay, so next part of the puzzle, I would say, is the education piece. So before you undergo any type of surgery, it's super important to know what you're signing up for, and especially when it comes to gender affirming care, because there are lots of different options available, and no two patients are alike, no two journeys are alike. So that's why we need lots of different options. So for example, some folks may never need or want any sort of surgical therapy. It doesn't make them any less trans. On the other hand, I've seen a bunch of patients over the years, for example, assigned male at birth who are getting bottom surgery who didn't realize that zero depth was an option. They didn't want or need the vaginal canal, and they didn't realize they could skip that. And so same thing goes for most surgeries. For example, top surgery, it's possible to go without the nips, it's possible to go non-flat. So it is important to educate yourself on the different options. And one of the ways you can do that is this book is available. It's a book I wrote with 9 other professionals in the field, and it's called Affirmed. It's available on Amazon, and there's lots of color pictures and diagrams, and especially when it comes to the more complicated things like bottom surgery, it's a really good resource because that education part is super important. And then the next thing I'm going to talk about is medical issues. So we think long and hard as gender affirmation surgeons before we turn a patient down for surgery for a medical reason, because these are medically necessary procedures. And so there are some things, however, that do make me nervous. So if you're a diabetic, let's say, and maybe your blood sugar control hasn't been great, now is the time to start figuring that out and talking to your primary care doctor. Same thing goes for high blood pressure. If you've been having some chest pain, maybe things like that, it's now a good time to look into these different things. Regardless of whether you're having surgery or not, it's probably a good time to have these things checked out. On the other end of the spectrum, if you've never been to a doctor, if you don't have a primary care doctor, now is a really good time to figure that out as well. Maybe get a primary care doctor, because usually most surgeons will want to see what we call medical clearance before surgery. It's, in my practice, is usually not very difficult to get, but sometimes in special cases, if somebody, let's say, has maybe a heart problem, we'll need that patient to visit a cardiologist before surgery. So it's nice to be getting those things going in advance. For folks who are over 40 who are considering top surgery, we're going to need to get a mammogram done. But a good place to start in all this stuff is just go see your GP. Just go get a checkup, especially if you haven't done it in a while, so that we have you in the best physical condition as possible in order to move forward with the surgery. And same thing goes, we can't forget about your mental health as well. One thing I always say about any sort of gender affirmation surgery, it's a big stressor. So if your mental health isn't where it could be, now's the time to work on that, because surgery can really sometimes push people a little bit over the edge if they're not doing well to begin with. It's a lot to be dealing with, and so it's best to have your mental health optimized. And then last thing we're just going to talk about is logistics. So think about your place, your people, and your finances, all that sort of thing around the time of surgery. In an ideal world, you're as financially prepared as possible, because sometimes there can be a little bit of extra time needed to be taken off work that might be unexpected. Not all patients are the same. It's not an exact science. Also, there'll be some expenses, for example, mastectomy pillows, dressings after surgery, antibiotic ointment, that sort of thing for top surgery. So we need to have a little bit of an extra buffer in order to anticipate that. Same thing goes, a lot of people have to travel for surgery. So travel and accommodation, all of those can be extra expenses. So we need to be saving and planning and thinking ahead. Your people, you're going to need somebody to take care of you, or to hire somebody. That can be done as well. But typically for top surgery, the very bare minimum you need somebody with you is 24 hours after surgery. It's optimal if we can have somebody longer. And same thing for bottom surgery. You're going to stay in hospital for vaginoplasty, for example, but it's really important to have somebody who has your back around that time, if at all possible. And place, accommodation, or what's your home situation like? Just making sure that you're in a comfortable, safe home situation that you can recover in after surgery. So these are all different things to think about. Like I said, check out this book. The Kindle version, I think it's about $10 on Amazon, because education is super important. So again, just to summarize, we're going to want to figure out the logistics, how we're going to pay for the surgery. Can we use our insurance? Can we start working on the requirements for that? We're going to want to think about our education. Are we doing the right surgery? Do we know all our options? We're going to want to think about our medical health. Is everything as optimized as possible? Our mental health. And then also we're going to just want to think about the little details around the time of surgery. How are we going to afford dressings? And who's going to be there to take care of us? So hopefully this is helpful as you prepare for surgery in 2024.